So welcome everyone today to our really important webinar called Many Faces of Elder Abuse, Insights into Loneliness, Mobility Challenges, Dementia, Representational Inequality of Black Older Adults. I'm so pleased to be joined today by our colleagues who are going to share their experiences and their research into this area. We're so glad that you're able to join today. Before we begin, I want to provide a land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. I just want to highlight that we are also hosting this webinar also in recognition of Black History Month, and hopefully people have been learning more about Black History Month and looked at many of the websites and work that's being done across this month. I know that there's many initiatives and webinars and information just to highlight the importance of Black History Month. So please take advantage of that and to learn more beyond the work that we're talking about today. So just some basic logistics, as many webinars that you've attended, everyone will be muted. And we do encourage everyone to post comments during the session in the chat box. If you have a specific question for the speaker, please put it in the Q&A box on the bottom, and we will talk about your question or address that to the speakers at the end of the session today. As I mentioned, we have our ASL interpreter with us. You can increase the size of the interpreters or the speakers on your own screen. They're in the little black box of speakers. You can either pull the images across to make it larger, or change the grid at the top of your screen to just on speaker view as opposed to gallery view. Those choices are up to you. Also, in terms of evaluation, we do appreciate everyone's feedback at the end of the session. So you will receive a follow-up email in a couple days, just as a reminder of the webinar and the recording access link, as well as a link to the survey. If you didn't yet get it completed after the session, you'll see a little pop-up box. There's only, I think, 7 questions, so we'd really appreciate your feedback. And the recording of the webinar will be posted on our website. I'm hoping to get that done today, but at least it'll be there tomorrow for you to access. Any of the documents or references that are posted today or mentioned by our speakers will also be posted on the website for your quick reference guide. And respecting people's privacy and confidentiality, we do just want to remind people that this is a public forum. And we do understand that some people may be encountering situations where there may be living with at risk or experiencing abuse and want some further assistance. We encourage you to reach out to our organization either by phone or by email, and we'd be more than happy to provide that support to you. Because this is public, people can identify individuals. So if you don't want to do that, we would encourage you to reach out to us. And just keeping some of those questions more of a generic sense, as opposed to some specific circumstances that you might be encountering. And just a little bit about our organization, if you haven't joined us before. So Elder Abuse Prevention Ontario has our mission to ensure that all seniors have a strong voice, are safe and respected. And in 2003, the organization received funding through the Ministry for Seniors and Accessibility, and we have been implementing Ontario's strategy to combat elder abuse ever since that time that they've given us funding to do so. That strategy has 3 main priorities: public education and awareness. We do much promotion on social media, World Elder Abuse Awareness Day, is coming up in June, so we're planning around that. So there's many initiatives that happen throughout the year, but particularly in June to promote the awareness of elder abuse. We do training to frontline staff, all sectors, to increase their knowledge and response to elder abuse, and also working with our community partners to strengthen the response and intervention towards elder abuse prevention, and helping the agencies understand options that they may have to support the older adult to minimize any risks that the person may be having and to prevent the abuse from happening further. I do just want to mention quickly, we do have a small but mighty team at Elder Abuse Prevention Ontario. We have 7 staff, and our staff implement many of those initiatives that I just mentioned. But we also support elder abuse networks across Ontario. There's more than 40 within different communities. I'd encourage you to look at our website to find those that might be in your region. Join if you're interested in finding out more what they're doing at the local levels. We do many projects and initiatives around elder abuse, not only within Ontario, but across Canada and sometimes beyond borders. And we develop many resources and materials that are available for you to access free on our website. And just lastly, just wanted to reiterate in terms of assistance, we do provide case consultations, providing information and referral. We unfortunately don't provide case management on complex cases, but we do have a lot of strong connections within our communities across Ontario to make those referrals for people to get direct access to support and information. So without further ado, it gives me great pleasure to introduce our speakers today. So firstly, I would like to introduce Blessing. Blessing is a postdoctoral fellow at McMaster University, a Commonwealth scholar and gerontological social worker whose research interests focus on understanding the experiences of aging, loneliness, inequalities, social exclusion, disadvantages of Black older adults, compounded by their social locations such as race, age, gender, immigration status, and employment. And also, she's been addressing the representational intersectionality of older adults in policy, research, and practice. Her current research agenda, which she'll talk about today, focuses on exploring the aging experience of Canadian-born Black immigrant Black older adults on a broader context and understanding how it constructs ideas and their lives in social context. She has a Bachelor of Science from the University of Nigeria, as well as master's degrees from the University of Southampton, the United Kingdom, and York University. And, if not all, also a PhD in social gerontology from McMaster University. She's also joined by Michael Kalu. And Michael is an assistant professor of rehabilitation therapy, clinical treatment, and clinical care at the School of Kinesiology and Health Science in the Faculty of Health at York University. He gained interdisciplinary expertise by training as a physiotherapist. He obtained his medical rehabilitation physiotherapy from the University of Nigeria. He's a social gerontologist and a rehabilitation scientist. He has completed his master's in science and rehabilitation from Queen's University and a PhD in rehabilitation science from McMaster University. And right now he's furthering his research as a postdoctorate fellow at Dalhousie University. So welcome. And lastly, Emiga. He is a doctoral candidate under Dr. Tamara Sussman at McGill University School of Social Work. Prior starting his doctoral studies, he was a medical social worker at the University College Hospital in Nigeria. He obtained his Master of Social Work from the University of Ibadan in Nigeria. He is an alumnus of Mental Health Leadership and Advocacy Program at the World Health Organization Collaborating Center on Mental Health, the Neurological Sciences and Substance Use, University of Ibadan, and the Global Aging and Policy at the University of Southampton. We are so privileged to have these individuals joining us today with their wealth of knowledge and experience, as you can see from their biographies, to share their information and research that they've been doing on the experiences of Black older adults. So without further ado, I'm going to turn it over to Michael to share his screen. Thank you.
Hello, can everybody hear me? Good. So we want to thank the leadership for giving us the opportunity to have our talk today. And before we start, we just wanted to kind of like highlight where we are coming from. So we are also a member of Emerging Researchers and Professionals in Aging, African network with our memberships across the globe, and as well as with our headquarters here in Canada. And today we'll be talking about what many phases of elder abuse, looking into the insight in loneliness, mobility challenges, dementia, and as well as a representation of how it influences Black older adults. I have to kind of like, as a disclaimer from the beginning, most of us, our research are not focused on elder abuse directly. However, we are going to take time today to see how has our individual researches influenced or contribute to the elder abuse among Black older adults. So this is the background of, this is the outline of what we're going to present today. We're going to do it in this sequential order. So we wanted to pick our brain. When you hear elder abuse, what comes to mind? You can actually look at you can use your phone. Apologies for those that cannot use their phone to scan. In the area of accessibility, I want you, if you are able to do that, please do scan whatever comes to your mind. It can be one word, it can be two, it can be a sentence. Whatever comes to your mind, you should be. We're going to give you some minutes. And again, if you don't have a phone, you can actually start putting them in slides as well. Put them on the charts. So as you can see on our slide, we can see some themes are already emerging. Individuals are focusing more on intersectionality, financial abuse. As you can see, the larger so many people said something about it, the larger it becomes. You can look at vulnerability. So in terms of what everybody's talking about, vulnerability is kind of like the main theme that is emerging with all the conversation that is going on this word crowd. So as you can see, as people are typing, the more people are typing, the more that particular words or that particular adjectives is being expanded. A typical example, you see physical is kind of like a neglect. You see how neglect kind of like emerged in a bigger font. So this kind of like highlight when you think of abuse, what people are thinking what is coming on in your mind. I think we are going to keep playing around with this, keep typing as much as you can. And I'm trying to quickly look at the chat and see what is there on the chat. So individuals, of course, the same thing, neglect, historical social justice, that sounds interesting, invisibility, and perhaps decrease in cognition, vulnerable to neglect, financial abuse, emotional abuse, and again, trusted others. That is actually very fascinating. And again, somebody said, Erin said, withholding basic needs. That is an interesting conversation you're seeing in there. And we've kind of like, we've reviewed the definitions of what elder abuse means generally. So in our definition, we've kind of like borrowed the concept of developed by WHO. So the WHO have kind of like described elder abuse as a single or repeated act, or even kind of lack of action that it often occurs within a relationship. And this occurs sometimes intentionally or unintentionally when you have an expectation of someone that you trust. And again, there has been a campaign about whether to use elder abuse or elder mistreatment or elder maltreatment. And this has led to different forms of elder abuse, including financial, physical, psychological, as well as social. So we thought, even though most of our researches are not done specifically on elder abuse, we've taken out our liberty to review what actually is the global prevalence of elder abuse. And this study was done by Ho and colleague in 2017. They conducted what we call a systematic review and meta-analysis. A systematic review, it's a form of review whereby you identify several articles. And then, based on that several articles, statisticians do a statistical analysis, and then they pool prevalence across each of those articles. So in this study, they included 51 articles across 15 and 17 countries. And when they looked at the pool, in this study, they identify emotional abuse has the highest number of prevalence among older adults. And if you look at the red link on this place, you see that elder abuse has 3.1%, which is of lower compared to other groups. However, we should be cautioned in terms of how to interpret this, because sexual abuse is one of the type of elder abuse that is less reported. And it's often very difficult for researchers to actually engage in that. This you can see among all the different types of studies, elder abuse is the least studied, also shown in this literature. So in the same vein, the same study, they looked at compare differences between non-Western countries, which is defined as countries in the global South versus countries in the global North, which is the Western countries. They found out that the prevalence of elder abuse is higher in those non-Western countries, which are predominantly low-income and middle-income countries. And they also reviewed and looked at what is the difference between male and female. They found out that females have higher prevalence of elder abuse. And again, remember, this is not a single study. It's a studies that are pulled together from different countries and different origins. However, and again, maybe this is my bias coming into play as a man, we know that evidentially, men are often reporting abuses, are often not their strong suit. And as a result of that, that might be underreporting when it comes to male being reporting their abuse. So we kind of we said, okay, how do we look at what are the differences between prevalence of elder abuse, Black older adult versus non-Black older adult? This study is also in the same systematic review they reported, and they did a comparison based on this race. They found out that if you look at all the things listed on Black regions, financial exploitation, psychological treatment, Black older adults have higher prevalence of elder abuse compared to non-Black older adults. Although they found that among the ones that are written on red, those ones that are red, it means there was no significant difference between people identified as Black and individuals of non-Black origin. So I think I'm going to get it back to Blessing for the Blessing to take the charge now and explain to us why is it important that we actually even focus on Black seniors, both in Canada and in globally as well. Over to you, Blessing.
Okay, hi, thank you very much, Michael. So we focus basically on Black seniors because in Canada, evidence has shown that the population of Black seniors is steadily increasing, and currently they make up about 15.9% of the total population of those who are aged 65 years and above. However, interestingly, Black seniors continue to report experiencing more loneliness, more disproportional disadvantage. And this is mostly because most of them have fewer ties and integration in Canada and higher life stressors, which kind of results to poorer health status. However, in many research, again, that has been done with seniors in Canada, Black seniors are less likely to be represented. And this is a significant gap that most of our research try to fill. For example, when you look at the Canadian longitudinal study on aging, is a data set that kind of captures aging experiences among Canadian seniors across their life course. If you look at that data set, there's not up to 5% of Black seniors in that data set. So that's the lack of representation that we are talking about in our research try to fill. Okay. So I'm going to start talking about loneliness and elder abuse. As Michael pointed out, none of our research focuses on elder abuse, but I'm going to try my best to pick out a few of the things I've had Black seniors talk about in relation to elder abuse and how it can lead to loneliness and the intersection between these two concepts. So in several evidence from Canada and within the global literature kind of point to disturbing prevalence of loneliness among the aging population. And specifically among the general population of seniors, loneliness has been associated with a lot of physiological and health outcomes, with including poor quality of life, poor cognitive functioning, and even limited physical and social functioning and increased mortality. Specifically, loneliness among older adults has been reported to contribute to as high as 57% increase in ER hospitalization and even higher medical costs. For example, between 2019 and 2020, it was reported that 1 in 5 seniors in Canada reported feeling lonely. And we know that older adults generally are at risk for loneliness, basically because they are more likely to face factors such as living alone, having experienced loss of family members or friends, having chronic illness and several comorbidities, and even experiencing abuse and neglect. So evidence abounds that shows us how older adults experience elder abuse and how this can lead to social isolation, and especially as abuse continues or worsens. In a research that was done with community dwelling seniors in the US, it was specifically reported that older adults who have felt lonely were more likely to be victims of any type of elder abuse. And so specifically, the presence of loneliness was associated with increased risk of psychological abuse, financial exploitation, and caregiver neglect. So in trying to understand the experience of loneliness among Black seniors in Canada, my research findings, along with several others in this field, highlights the interaction between culture and loneliness. And however, funny enough, when I started, my interest wasn't really on understanding culture. I wasn't really interested in culture and loneliness. I was more interested in understanding what is it about connection? What is it about social connection that, informs loneliness? But as I continued my research, I began to hear a lot about culture and loneliness and how that's, the big role that plays. So what is known is that culture significantly determines how people experience relationships, including relationships where we are abused and neglected, and loneliness. And this is because culture contributes to forming a society's normative values and meaningful practices and perceptions that people have. Secondly, loneliness can be influenced by an individual's country of origin and even people's cultural background. For example, in a culture where people value family relationship, an individual who's facing abuse by a family member will find it difficult to report the abuser. And this is some of the things I've heard a lot from immigrant Black seniors. And so these relationship patterns observed by different cultural groups impact individuals within this culture. And our individualistic culture in Canada kind of makes an already bad situation worse, as everybody is minding their business and does not really care who is dying beside us. Therefore, the crisis of connection that we have today is a big issue with our culture that needs to be addressed. So how I've conceptualized cultural loneliness is the feeling of emptiness that arises when somebody moves from, to a foreign culture, thus leaving one feeling misunderstood and unable to reciprocate understanding and even understanding about cultural meanings and significant cultural issues in their new location. And so this explains why you would have a lot of immigrant seniors who have language barrier, people who can't speak English or French. When they move to a new country or new city or culture, you'd hear them complain about experiencing loneliness and having that feeling of loneliness. And funny enough, a lot of research tend to focus less on this area of research. So the current evidence from my research with immigrants and non-immigrant Black seniors, and I will more likely use BOAS. So if you hear me say BOAS, B-O-A-S, is basically me saying Black older adults. It suggests that loneliness among Black seniors or BOAS is experienced alongside a complex overlap of temporality, relationality, and speciality. So starting with the interplay in terms of time demonstrates how the experience of loneliness among BOAS changes across the life course, portraying the negative and the positive transitions that BOAS go through right from their arrival as new immigrants and even decades after. So when these experiences are favorable, what I've seen in my research is that it serves as a protective factor against loneliness. However, when it is not, the experience of loneliness tends to linger. And it also uncovers how patterns of family relationships have changed across the time course. Secondly, in terms of place, my research with BOAS demonstrates that when immigrant Black seniors and those who live in communities that are not ethnically dense, when they do not have a sense of belonging and feel that their identity is not accepted within the communities, perhaps due to language barrier, due to accent, due to race, this contributes to their experience of loneliness. And sometimes it can also lead to denial, identity denial, both by self and others. And when we talk about identity denial, it's just, talking about increasing the feeling of not good enough. And so it becomes challenging for these individuals to integrate into their new communities and form meaningful connections and relationships. However, this is an important area of research that my research has advanced, and more research is needed in this area. So some of the narratives that were predominant in my study is the narrative of cultural or conflicting cultural practices and cultural intolerance, which contributes to that pressure of identity denial that I talked about. And also identity denial, again, could also point to switching color code, the pressure to act or speak in a specific way that is predominantly more acceptable within a particular location or community. And these points or highlights are continuing racialization and the feeling of not good enough that I'd mentioned before. Again, there's also the narrative of making a new home, which reveals how Black seniors transition across their immigration trajectory. So in essence, when Boas talk about their processes of making a new home, they would tell stories of varying exclusions that they experienced and the adapting processes when they newly arrived in Canada. And most of these exclusion are what contributes to elder abuse, which can be from people they trust or from people in the community. So to highlight some of the aspects of experience of elder abuse by Boas and racialized immigrant seniors, I looked at several other qualitative research that has been done in Canada. And I think in this study, I included about 10 articles from different provinces in Canada, about 6 provinces in Canada. And one predominant finding is the disposability of immigrant older adults by their family members and the struggle and trauma that are experienced by this population. As narrated by one of the participants in Alvi and Zaidi's work, their work was done in Southern Ontario. If you look at what this woman said, she said she's scared of her daughter-in-law. And we know that immigrant Boas and racialized seniors are often, sometimes they are often sent out by their family members, and sometimes they are also threatened by their family members to send them back to their country of birth. And most times going back to their country of birth is not an option that Black seniors want to take because of the economic situation or the living situations in their country. I had a story of one of the participants who was sent out by their family members, and it was a very terrible one. And these are the stories we've had. And she had to live in shelter when her family are actually living in Canada. So these are some of the real life stories that I've had from Black seniors, a whole lot of them. And so what you also see is sometimes when they are threatened like this, they become extremely afraid of their family members and the relationships worsen, and they keep suffering in silence. Even when they decide to stay back, they experience neglect. So I thought that this experience was actually unique to only Black seniors. But looking at exploring and seeing all this other research that have been done with racialized immigrant seniors, it tells us that it's something that really needs our attention. So we're gonna do another Mentimeter to look at some of the factors. What are some of, I've really delved into some of them, but what other factors do you think might contribute to or increase the chances of elder abuse among Black older adults, or maybe racialized seniors in general? So Mike is gonna do another Mentimeter. Mike is gonna share his screen. You can also put it in the chat. Okay, Mike, you want to take over?
Yes, thank you. Thanks, Blexen. So as you can see on the screen, everybody's kind of like covering what we already had in mind in terms of what are the factors that could actually influence. And these are not just from ideas. These are purely based on evidence that is out there. This also was based on a systematic review that has been done to look at the factors that increases the chances of elder abuse among Black older adults. And of specific interest among these factors, we are going to really talk more about it is being homebound. The situation of being homebound. And I think we are going, because of time, we would have continued having fun with this app, but let's continue the presentation and we can share what everybody's thinking about this app when they. So the the contributory factors are, as we have all listed on the list that you list, as you can see, it seems that most of you already saw our slide before you talk. So exactly, some of you use exactly the same language, language barriers and living arrangement, that is a big one. But today, because of our expertise and because of time, we're actually going to hone in into the two concepts. The homebound, which actually speaks more on mobility, and again, cognitive impairment, which kind of like highlighting dementia. How does this contribute to elder abuse? I think this is my research actually focuses more on mobility. I looked at mobility in a very comprehensive aspect. So in my research, I looked at mobility broadly, movement from point A to B, regardless of how you got there, whether you got there by yourself or use of assistive devices or even use of scooter. So my research is also advancing into looking at how accessible is transportation for older adults to move from one place to the other? And again, how does driving skills and how are we ensuring that the older adults are being taken from one point to the other? Even flying overseas is an aspect of the research that I do. So another issue is that mobility is very complex. And this complexity is embedded in several factors that either influence mobility or mobility influence in. There is this cynical association between mobility and other several factors, including social, even including elder abuse, and even some other cultural factors as well. And for you to be able to solve the complexity of this mobility, interdisciplinary approach is very, very ideal. So when you look at homebound has been defined as if you are unable to leave your bedroom, house, and yard for 1 week, you are described as homebound. And research has shown that older adults who are often homebound are more likely to be victim of abuse. So I thought, what is mobility limitation? We've talked about what mobility is. Now I'm trying to dive into what exactly is mobility limitation. So when we look at mobility limitation entails the inability of an older adult to either walk a mile or even have access to transportation or driving. And older adults with mobility limitation are more likely to be lonely, have poor quality of life, and also be a victim of elder abuse, often resulting in hospitalization, increasing hospital costs, and as well as mortality. So I thought I should kind of like bring this in here. There has been a lot of conversation around mobility, specifically gait speed, being identified as 6 vital signs. This is also a systematic review that was done by Middleton et al. In 2015. They brought so many other studies into one, and they gave us demarcations of when you have the level of gait speed where you have, which give us an information of what is happening. A typical example is the first one, when you have a gait speed of less than one, an individual with a gait speed of less than 1 is more likely to require help. And this help is when another adult requires help, that is more likely that the older adult will not report the perpetrators of elder abuse. So the other one is if they have issue with community ambulation. A typical example of having community ambulation is when their gait speed is less than 0.8. They are not able to go into the community. And as a result of that, reporting elder abuse becomes an issue for them as well. So I thought in terms of mobility limitation among Black older adults, it's always on the increase. As you can see, a study in 2016 reported that Black older adults have higher increase in mobility. And also in mobility disability, Black older adults start earlier to have mobility disability compared to other populations. Another study, and I said, oh, that is an old study. Now, a recent study that was actually done in the US also reported a comparison between white older adults, Hispanic older adults, and Black older adults. They reported that older adults has close to 33.3% of mobility limitations. Next slide, please. Next slide. So I said, okay, what are the big ideas when it comes to mobility limitation and elder abuse? So the first one is increased vulnerability. Like I have been saying, Black older adults may face higher rates of elder abuse due to various issues such as social isolation and economic disparity and historical injustice. And because they have mobility limitations, it can make them vulnerable to abuse. And as they might be physically dependent on others because they cannot do things on their own. Another one is the issue of barriers to reporting. Mobility limitation can make it harder for an older adult to report abuse, especially if they rely on their abuser for their mobility care. And this often results to underreporting of elder abuse because they have mobility issue. Underreporting of elder abuse is eminent. Another one is the intersectional discrimination, which focuses more looking at the intersectional issue based on their race and as well as physical condition and health disparities. So because they have all these compounding issues, this can exacerbate their risk of abuse and make it harder for them to seek help. So I now thought the overall implication of health of it means that elder abuse can, when an elder is abused, it can often lead to physical injuries if it's a physical abuse. And as a result of that, and even psychological trauma. And these factors are known to worsen mobility limitations. Now, this cycle of abuse, neglect, mobility decline, social isolation, social loneliness has a big implication for health and well-being of Black older adults. This comes down to that initial statement I made that enabled for us to understand the intersection between mobility, social isolation, and elder abuse. It requires an interdisciplinary approach for us to be able to solve this problem. I think I'm going to hand it over to Oluwagbemiga to provide us an aspect of how dementia can actually influence elder abuse.
Thank you, Mike. I feel so honored and delighted to be here. My area of interest is in dementia care, and I've been doing that for more than 10 years. And I have both lived experience of having my maternal grandmother with dementia, though of blessed memory, and being a clinician with over 10 years experience caring for older adults with dementia as well. Let me start with the current prevalence, which is more than 60 million individuals living with dementia worldwide. And there are more than 10 million cases which have been reported every year. My discussion this evening is to open our understanding of the fact that elders abuse within the context of dementia, within the context of older adults with dementia, is on the rise due to so many reasons, which we're going to talk about. There are abusive behaviors which are very eminent around the fact that older adults experience and go through a whole lot of abusive behavior, not only within the community, but also within several settings, like long-term care settings. And we've found that, and we've seen that there are a lot of structural barriers to it that actually leads to the late diagnosis of dementia. And some of those structural barriers, which also includes limited access to healthcare, mistrust of the medical institutions, as well as cultural stigma around dementia, which contributes to the disparity in dementia diagnosis, as well as care for Black older adults. Next slide, please. I would like to really speak to the vulnerabilities of, the intersectionality of dementia as well as elders abuse. First is vulnerability of elders abuse. We've seen individuals with dementia which are very particularly vulnerable to abuse due to their cognitive impairment. Imagine a challenging situation navigating complex circumstances, and memory, judgment, as well as communication skill as being compromised. The vulnerability can make it very, very difficult for an individual with dementia to recognize abusive behaviors and communicate their experiences effectively. And due to this fact, they are often at greater risk of exploitation as well as mistreatment. Let me talk about the types of elders abuse within the context of dementia. We've seen physical abuse, which involves the use of force or violence, which often cause harm. And we've seen emotional abuse, which also encompasses verbal insult. We've seen threats, intimidation, financial abuse, especially within the context of dementia, like their finances, their assets, which is being taken away, and neglect, which often occur among families or probably caregivers who actually fail to provide necessary care. Some of the challenges we've seen is recognition. My colleagues, Mike and Blessing, have really spoken about this, recognition, recognizing and reportage of elders abuse among older adults. It's very, very, very difficult because, for example, memory loss may take its own challenging time to recall specific incidents of abuse, while communication difficulty may also hinder the ability to articulate concerns or probably seek help. Next slide. Representation of inequality among Black older adults, Black older adults with dementia, which is my major focus of my home presentation. I will speak about this in three spectrum. Number one is the historical context of systemic racism and discrimination, which is faced by Black older adults within the community. For centuries, let me take us back to memory lane of the fact that Black older adults have been subjugated and have actually experienced brutality from slavery. It is very unfortunate that up to date, Canada doesn't have a Black-focused data on older adults with dementia. It's really unfortunate, and this itself actually leads to the fact that we have limited number of Black physicians or Black healthcare providers, hence limiting early diagnosis, which actually leads to early diagnosis, and then disparities still persist, even in the prevention of dementia care, and as well as treatment of chronic conditions. Let me speak to the manifestation of inequality within the context of healthcare, media, and social services. Black older adults may face barrier to accessing timely diagnosis and appropriate treatment of dementia due to factors such as limited access to healthcare, including lack of culturally competent care and implicit barriers among healthcare professionals. Even after diagnosis, oftentimes we've seen Black older adults with dementia receive lower quality of care compared to the white counterpart. These could be due to disparity of in terms of treatment options which are offered to them. And then the variations in the availability of support services, which oftentimes are not tailored to the need of Black older adults. Oftentimes, we've seen the media portrayals of dementia, which actually perpetuate stereotypes, stigma about aging, dementia, and Black individuals. For example, Black older adults with dementia most times are often portrayed as in the negative light and reinforcing harmful stereotypes, as well as contributing to the social marginalization. Let me speak to the last one before I hand it back over to Blessing, is the impact on access, which has to do with resources. Black older adults with dementia may face a whole lot of economic disparity. We've all mentioned it in the survey we did previously. We've spoken about financial constraint, economic disparity, as well as a whole lot of things that increases their vulnerability. and the limited ability to access quality healthcare, supportive services, and residential options. There are limited community resources which are predominantly for Black neighborhoods, including senior centers, adult daycare centers, and caregiver support, which often further exacerbate the disparity in access to essential services. And on this note, I would like to hand it back over to my friend, Blessing, to round it up for us. Thank you.
I was muted. So from all that my colleague Bemiga has said, I think it is important to also kind of emphasize the issue of lack of cultural appropriate interventions and support for immigrant seniors, which might be a big reason why we keep having the problem of elder abuse persisting. And most intervention, again, tend to focus on younger population. When we talk about immigrant population, they focus more on the younger population, further encouraging the erasure and representational inequalities or inequities that are faced by racialized seniors in Canada. And when we talk about erasure, we're simply talking about the practice of collective indifference that renders certain people and group invisible. And some of this might include like diverse roadblocks hindering access to available resources for Black seniors. So then what is the solution? What do we recommend? We know we might not have a lot of time to keep talking what needs to be done, but we have just mapped out a few things that needs to be done, which we think would help to address the issue of persisting elder abuse among Black seniors. So the available evidence highlights the need to understand the differential experience of aging by Black seniors and the constellating social, personal, and structural forces and systems that contribute to elder abuse among Black seniors, not just on the micro level, but also on the macro level. So we believe that part of the solutions to addressing elder abuse among Black seniors is the need to build trust and connection that will help to mitigate the representational inequity and improper access to resources. And the truth of the matter is that people can only trust you if they feel safe and that they feel that you can relate with their experiences and understand their point of view. If they don't have this feeling, there's not going to be trust. And we know that from the deep-rooted impacts of anti-Black racism to generational and intergenerational racial trauma that have been experienced by the Black community, without mental health assistance and cultural biases, sharing common ground facilitates connection and trust by the Black community. Secondly, we believe that it is important or relevant to address the lack of representation, participation, and integration of Black seniors, especially immigrant seniors, from existing programs and services. And this can be done by designing programs and policies that center the need of new racialized and minoritized immigrant seniors, rather than just focusing on the younger population. Because when we build interventions that are Black-centric and focus on community empowerment, we create space for Black and racialized seniors to feel seen and feel heard. And I think when we begin to do this, it helps us to address the issue of elder abuse among Black seniors. That being said, there is need again to resist the pushbacks that we are beginning to get against EDI works today in the form of disengagement. And when we talk about disengagement, we're referring to the belief that people hold that it's not their problem, it doesn't concern me, and also the problem of denial, where people believe that it is not a problem at all. Why should we be talking about this? And then there's also the problem of derailment, where you would see people believe that, oh, there are also other problems. Oh, why should we be talking about Black people only? Why should we be talking about this? And that's part of the problem we are having. And so therefore, identifying these pushbacks and having the language to articulate it will help us to challenge and draw attention to several resistance to EDI efforts. And these can even be addressed by simple acts such as targeting some systemic, organizational, and community individual levels through a simple commitment, like, making commitment to staffing, ensuring that we include Black people in our staff, investing in programs that will empower the Black community, and being critical and self-reflective on how we provide service. So in conclusion, to mitigate loneliness and continuous abuse and neglect among Black seniors and other racialized seniors, it is important that we also want to note that available evidence calls for intentional efforts in our commitments to the improvement of conditions that discourage this population of Black seniors from social participation, and also hinder their integration into their new community and ability to have access to available resources. Because success in this line will contribute immensely to mitigating the experience of elder abuse, including loneliness and several forces contributing to cumulative disadvantages of Black seniors. Because at the end of the day, the secret to success in this line is being intentional about our actions and being curious to learn how to best support Black seniors while providing compassionate care. Thank you very much. And this is our contact, just in case you want to connect with us. And most of the references we have used, we've included them here. And like Rian said, the slide is going to be available in 1 or 2 days. Thank you very much.
Wow, that was amazing. Thank you all for your great wealth of knowledge that you've just shared with us today. I've been taking notes and learning as we go. And I think we did a webinar last year when we had a physician that joined us, and the talk around being culturally appropriate care was brought up, I know, in that session. And do you know if there has been any sort of work that has been done to move that agenda forward? And from your experiences, I know you all come from different areas and cities that you're currently working in. So, and if you're involved in some of those solutions that you mentioned today, and as you're thinking about that, just as a reminder for people to put their questions in the question box. I don't know who wants to answer that question.
Yeah, in terms of work, I think there are a lot of work that are currently being done, both by individual and by the government. Because we know before what happened to George Floyd in 2021, yeah, there weren't a lot of attention, a lot of sensitivity to what is going on within the Black community. But after that, I would give it to the Canadian government, I would give it to individual organizations, I would give it to researchers, I would give it to the people of the Black community. There's been a lot of effort that has been put. When you go to several universities now, there are research centers that are focusing on the Black community. I know at U of T, they have one going on. And at York University too, they have. At Manitoba University, where I'll be joining them very soon, they also have things going on. And McGill too, they have things. So there's a lot of programs going on. And what people have also done, Black seniors on their own have also come together to kind of inform, help themselves to start up that culturally focused activities. I have a group in Windsor that meets every week. They are Black seniors. They participated in my research, and they meet every week to kind of create that sense of belongingness. Because at the end of the day, there's need for that belongingness and for that sense of, that feeling of inclusion. And yes, I would say there's a lot going on. It might not look like it, but there's a lot going on because we're talking about seniors, right? You would hear a lot about younger population. Oh, young people, these, that. Seniors are, more likely to be excluded. There's a lot going on, but it's still not enough.
Right. Thank you so much for sharing that. And like you say, sometimes it's not visible. You have to kind of search it out or find the people to the services or programs in the community. So, and it's nice to hear that there are more more work being done at the universities to address, all different issues around this. There was one comment or question saying that excellent presentation, so thank you all. On slide 6, you talked about the global prevalence of elder abuse by subtype are much higher from those found in they're much higher than those found in Canadian studies. Can you comment on why this discrepancy might exist? Our programs track what kinds of abuse our clients are experiencing and what we're always searching for evidence-based benchmarks. Thanks for your insights.
Yeah, okay, I think I can speak to that in terms of why there is way higher than those found in Canadian studies. I think it's also boils down to some of these countries, specifically based on my experience in the UK, they already have a system on how to be able to track each of these abuses. And again, with the advance of technology, a typical example is the Tenera. For some of us that work in a long-term care, with Tenera, you can actually have an indices of how and what has happened or what has transpired. Of course, with the privacy issue, the older adults and the caregivers are in on it to be able to use that. So I think it's all boils down to reporting, excellent reporting, and it's a good job that your organization is kind of like tracking the kinds of elder abuse that your clients are experiencing. But again, I have this idea. It's you can only write what you are told that happened. So there are so many implicit issues that happens that are not being reported. But some countries like Finland, having stayed in Finland for some time and in the UK, they have a well-structured approach on how you can report abuse without actually letting the person or the abuser know that the person is reporting the person.
Yeah, thanks, Mike. That's a really good point in terms of data collection and Kim's question too, because we don't have a centralized Canadian data collection system, so it is really difficult to figure out what the disparities and discrepancies between even just different ages and ethnicity, race, everything. It's we don't have that, and that's one thing that we're striving and moving forward to is how do we change that dynamic and to find out the extent of the problem so we can better address it, not only within with programming, funding, etc. That plays a key role in that whole factor. So thank you for that question and your response.
Yeah, I think again there is US are doing it better. At least US have a Center for National Elder Mistreatment Study. So they've created that specifically to collect data for elder mistreatment. Is a study. I think this is a very, very good place that the government can actually look into, and the organization, the Elder Abuse Prevention Ontario, this is a good study that can actually be looked into. And again, it can be a longitudinal study that can be carried over a long period of time. Our sister countries are doing it, so why can't we do it?
Yeah.
Right.
Yeah.
The different countries, I know that in the States, they have adult protective services in almost every state, which makes it a different, they have that their system is different than what we have in Canada. So that collection is sort of centralized in some ways, but I agree that the models that we can learn from some of these other jurisdictions that you've talked about. So there was, again, just sort of tapping into that, we'll ask that question was the differences. Another question was the difference between Canada and US between provinces. I think there is differences, but we don't really know how to track them specifically. The other question was, what is one concern with expected increase in dementia? That was a good point.
Yeah, it's a very great point. One major concern we should be expecting is the increasing prevalence. In the increasing prevalence of dementia is the fact that we're going to have more cases of elders abuse. We're going to have more people seeking care. Hence, when they seek care, how long will they present themselves in the hospital setting? Then we are at risk of having older adults presented in the hospital with cases of late presentation, Hence, we need more physicians, of course, to cater for this set of individuals, And unfortunately, there are limited Black physicians in the country. And I said it earlier, and I will keep saying it in every platform which I'm being given an opportunity to talk, is the fact that we need a Black data. We need data that speaks to the number of Black older adults with specific conditions like dementia. Why? Because this would help us to tailor our intervention, treatment options, and also create policy framework to support older adults. Even existing national dementia strategy is not culturally appropriate for existing increasing rate of Black older adults coming into the country. We have seen an exodus of Black grandparents, which are coming into the country, developing dementia in the country. You know, it's an eye opener for the country. It's an eye opener for every one of us who are professionals and clinicians.
Right, thank you. There's another question about, and maybe this is for Blessing, you've talked about isolation. Do you feel that online resources such as Zoom and FaceTime have helped with isolation for older adults, or is this too big of an issue of access? So maybe this is sort of, even when we talk about transportation, but it's also mobility and connection, right? So has the technology, is it a good thing, or does it create more of a form of abuse when you take those devices away then?
Thank you very much for that question. I think technology in terms of social isolation and loneliness is a double-edged sword. It plays a role, it plays a dual role. Number one, it reduces and has helped to reduce maybe loneliness and probably even social loneliness and social isolation. For some people, however, we still have these persisting problems where you see a lot of, especially I'm going to use Black seniors, a lot of Black seniors don't still have access to technology. And even when they have access, they don't have the know-how. Mm. So there's the problem of ease of access and the ease of oppression and the knowledge problem. So, and then that becomes a big problem. I have the computer, I have the laptop, I have the tablet in front of me, but how do I join Zoom? Who would help me to click on the link? How would I know about that? So the inability to do all this still contributes to that loneliness. But again, there's also the problem of cybersecurity that we need to worry about. So should we say we should take away the computer or the tablet or the technology from them because they are experiencing abuse online or they are going through cyber abuse? Which I don't think that's the problem. I think the problem goes back to technological education. How do we educate them to stay safe while they are using that? Because at the end of the day, we want to ensure that we are mitigating social isolation. And at the same time, we are helping them to reduce loneliness, which evidence has shown us that one of the effective interventions for reducing loneliness might be social loneliness and even emotional loneliness is the use of technology. So I do not support the idea of taking it away, but I support the idea of providing adequate training on how to stay safe while using technology out there and making it available and improving the ease of access. I think we've done a research on that, on the role that technology, telephone, television, and radio plays in reducing loneliness among Black seniors.
Great, thank you. We just have to wrap up. I just have a few other slides to just to address. Oops, I'm just gonna, sorry. Just as a conclusion. Oh, sorry. I'm hoping this works. No, it didn't go. So I apologize for going really quickly through these. I just wanted, there are some resources. I will put this up on our website after. Some people were talking about sort of resources and reporting. There are mandatory reporting lines that people can refer people or report to. However, those are only in long-term care and retirement homes. We don't have mandatory reporting, as many people know, in the community setting. But I just based on time, I'm going to, people can refer to these slides in the slide deck that will be available when it's posted online. You can also find information on our website. If you go under the About Us and looking for services, you can search the database to look for your jurisdiction that you live in. and what services are available. And you put keyword searches in. This is connected to the 211 database for people to have ease of access to finding out further information and resources. Just lastly, we have been talking a lot about risk issues and understanding how to assess risk in the settings as a provider that's doing intervention. We have another training. This is our 4th training that we've been doing with frontline providers and understanding how to assess risk. And I see a few of our colleagues who have participated in our last session online today. We did talk about, we do case studies and we talk about different diversity issues when it comes up when we do case studies. So if people are interested in learning more about that or registering, you can find that also on our website as well. Just a reminder, if you're interested, you can join our newsletter. We have lots of information, resources, reports that we post on a regular basis. And you can find, it's posted on our website, but you can also sign up on our website to receive that. Again, I want to thank you all for your presentations today. I know it's a tremendous amount of time it takes to prepare and share this information, and to our ASL interpreters, did an awesome job today. And for you that all have attended, thank you for taking the time out of your busy schedules to participate. This is my contact information. The contact information for the speakers that has been requested will also be available on the slide deck, but I'll also put it in on the website so it's easy to access, so you don't have to go into the PowerPoint. I will post that as well as some of the research and links that the speakers are involved in for you to review. If you're interested in looking at some of the research articles, then you can look at that as well. So thank you all again, and have a great day. And I know there's another question, but we don't have time, unfortunately. So thank you all again, and have a great rest of your week. And I appreciate everyone for attending today. Thank you.